Recording in progress.
Okay, good. I'll get going then. Okay, my name is Jerry Hall. I'm a former BHAB member. I served on the Behavioral Health Advisory Board for about 6 years, 5 to 6 years, and have been going to all the meetings since then, since about April 21, and participate in a lot of the different committee meetings and all. And prior to that, I was on the Alcohol and Drug Advisory Board, which is called ADAB, and they eventually merged with the. They eventually merged with the BHAB in order to integrate, our services, because there was so many, or there are so many different or common characteristics of the SUD and the behavioral health work, or the mental health work. So we were able to merge, and that created a lot of efficiencies. I do want to start that acknowledging that we work in San Diego here in traditional lands of the indigenous Umaye tribe, and work in a nation with Black and African Americans who since 1769 and 1619 respectively have been traditionally suffering under great U.S. authority, neither having been sufficiently honored or compensated for their historic losses. And I work to live up to our promise of being one nation, indivisible, with liberty and justice for all. So I'll be handing out this deck after the presentation, and encourage you to check these kind of statements out, because they're really helpful. If anybody is out there that I'm hearing some background noise, if you can mute yourself, that'd be great. Okay, the Behavioral Health Advisory Board, not sure what that is. Well, that's another thing in my place. Okay, the Behavioral Health Advisory Board was created because of the Mental Health Services Act laws, which basically dictate that a tax collected from millionaires is used to help pay for mental health services in the state of California. And part of that deal was that they would have an advisory board in each county making recommendations. Excuse me for 1 minute. Of all things, my smoke alarm decided to just go off at this minute. Okay, next slide. There's some distinctions here between the CPP processes and the MHSA 3-year plan that really need to be made, because we often conflate the existing 3-year plan that's out for public review. That's often conflated with the CPP. The CPP is a process of how the behavioral health services will engage the community in their decision-making process. And that includes throughout the year, the evaluation, the strategic planning, and the goal setting and the budgeting for the next coming year. The way it exists right now, we have a 30-day period for the community to approve a plan that's issued by BHS, but there was an extensive amount of time before that, an extensive amount of resources and tools that haven't been provided necessarily, and a lot of stakeholders haven't been completely trained and able to meaningfully participate. So the big differentiation here is there's CPP processes, which are the engagement processes, and the MHSA plan is something that is developed through those processes, so that when the community is engaged, we work together with BHS to create this 3-year plan. A lot of the things that will be discussed here are my contentions and open for debate, and I'm certainly subject to correction and open to correction as well. So this is I've received several trainings from the state and from MHSA providers. So I'm reflecting what I learned from them, and I cite everything and try to document everything so that you can use that. In San Diego County, we codified the MHSA laws and from our bylaws. So the Behavioral Health Advisory Board has its bylaws, and then the county codified that. And we're actually subject to the codified version of the county. The bylaws are merely used to guide us. So the two issues in here, one is that we're mandated to encourage public participation in the policies and programs and to advise the Board of Supervisors. That's the state mandated issue. And then the county went a little further and said, we're also advising the chief CAO and the director of HHS and the director of DHS. The issue that we're a contention here is that we do not formally bring the community program planning processes to the Behavioral Health Advisory Board and get their approval as required by law. We tend to, once again, conflate that within the 3-year plan, but there is a very specific mandated issue that the advisory board is supposed to review and approve the community program planning processes. I'm going to skip over, not skip over, but just real briefly mention these things, but you'll all get this deck and you'll be able to read it through and learn as much as you like. These are the general standards that the MHSA and the guides counties to ensure that the MHSA plan is a community collaboration, it's culturally competent, it's client-driven, family-driven, focused on wellness, recovery, and resilience, and has an integrated service experience for all clients. Code itself in the California Code of Regulations states that the CPP funds that we're going to be talking about should be used for staffing for specific staff within the county that are focused on the community planning process. So there needs to be a staff that are specifically focused on that and specifically tasked with that. And there should be a diverse range of stakeholders, a meaningful participation throughout the year, especially with people with serious mental illness and their families, and that any stakeholder, be it staff, providers, or community stakeholders, need to be trained so that they can make more informed feedback. So a lot of times counties will do that training right in front of a forum. So they might spend 15 or 20 minutes on training or a half hour on training and then jump right into the program. This training can also, which we haven't necessarily seen, but it can also include sending BHAB members to conferences and training seminars and sessions. And it can also be used to send stakeholders that might include the community or family members. You can also pay for them to go to these conferences and training so that they can come and make more informed feedback in the community program planning process. There's within the MHSA, there's several components, work plans that are community services and support. And I give a brief definition of these and a much more detailed explanation later. When the MHSA funds come in, they have to be divided a certain way, and a certain amount of money goes to each of these categories. So community services and supports, prevention, early intervention, innovations, programs that are used with innovative approaches that haven't been replicated elsewhere in the state. And then the other two are workforce education and training, which there's a very significant plan out right now for an innovation fund that is focused on workforce education. But these are two separate categories. There is additional funding for workforce education outside of the what you'll learn in the innovation program. And the last thing is the capital, facilities, and technical needs. That's could be used for data systems, communications, not just capital facilities, but it can also be used for technical needs, and that includes the whole data realm. The DHCS, the Department of Healthcare Services, which oversees the MHSA, also has two fact sheets on how MHSA money can be used to support homelessness or people eradicating homelessness, as well as supporting individuals in the criminal legal system. So these are special fact sheets that they published because there's a lot of questions about how can money be used to serve these individual cohorts. So this is important to know because there is money sitting there that might be allocated not just to these programs, but also to these two special categories. Outreach and engagement is another part of the California Code of Regulations that describes what outreach and engagement funds can be used for, and that includes the CPP dollars. So it can be used for strategies to reduce ethnic racial disparities, food, clothing, and shelter, and you can use it to fund different types of organizations and different levels of outreach. These are also areas that are often a lot of concern, and a lot of people don't understand, including myself. I don't fully understand this, but each one of these program areas, the CSS and the PEI and the innovation and workforce, all have different capabilities to fund different types of programs and serve different types of individuals. So this is something that, serving on the Behavioral Health Advisory Board, I didn't fully understand that. And I think that misunderstanding is a lost opportunity for me to give more informed feedback on how monies can be used for different things. In this particular year's MHSA 3-year plan, there's a significant body of work that includes the community engagement plan that was done by UCSD under contract with the county. In that, I encourage you to read it, but in this plan are 4 pages of recommendations, and these are very specific recommendations UCSD team came up with after holding a number of forums, individual interviews, all different types of stakeholder engagement over the past year. And it is a rich body of recommendations, but if you also go through the report, there's an extensive amount of work, and it's I really applaud that. San Diego State had done the community engagement reports, and we had a much more limited number of forums, and which kind of limited their capability to give more informed recommendations. So this is I encourage you, if you don't read anything in that plan, please read these 4 pages, because this is a significant number of recommendations that very specifically target different needs. One thing that I didn't fully understand on the Behavioral Health Advisory Board is there is a very large department. At the last I heard, we had 60 people in the team that are the quality improvement, quality Q&I team. And that body looks at the outcomes over the past year and previous years, and then comes up with a work plan. And those are the goals that we decide to, or the county basically is focused on in the behavioral health services area. So it's this plan is done yearly, and it includes several outcomes that we're going to shoot for. And then right about the same time, an evaluation of the previous fiscal year comes out, and that helps inform people so that they can help build a better plan for this year. So the Q&I program has several different committees and groups that they work with, and it is probably the biggest asset that the BHAB has that is not really used as full as it could be. So this group meets on a regular basis, and I was a BHAB representative for I think a year or so, and these are the goals that we're shooting for. So when we're giving feedback and asking the behavioral health services leadership, when we're asking them questions throughout the year, we should know that we are focused on these goals. And when you open these plans and look through these goals, you'll see that they're very specific, and these are the measurable outcomes that we're shooting for. And but it's often unknown to the the Behavioral Health Advisory Board and by extension, the community, I believe. If we don't know what we're shooting for, we're giving feedback on things that may very well not be as productive as they could be. There's also additional opportunities that I believe are, we need to improve, and that is an updated website that all boards, committees, and commissions, agendas, minutes, and records. So right now there are several consoles within the system of care, but the last agendas and minutes might be a year old or 9 months old. And so if these meetings are being held on a regular basis and we're expecting the community to participate, not having current agendas and minutes and support documents and opportunities to contribute feedback other than being at the meeting, is more missed opportunities. So there's also a lot of concerns about how we distribute documents before the meetings that go to the meeting board members or the advisory board members, but that might not make it out to the community, and a lot of last minute documents come in, and there needs to be, in my opinion, shoring up of how we handle documents and how we miss opportunities to get that information to the public so that they can read this stuff and understand it, so that they can come and give better and more informed feedback, especially the board members. I served on that board for years, and dropping a document on us on the day of the meeting is near useless, because we're at the meeting and we're focused on many other things. So, and then posting all that stuff up on the internet and having it up on a timely basis is crucial. So these are there's other ideas here where, interest lists, where there's a number of topics that we focus on within the BHS that if we had a list of people that were interested in different things, we could have more focus on who we invite to what tables and what conversations. And it really helps volunteers too, so that we're not having to wade through a bunch of different things in order to just zero in and give ideas where we in areas that interest us the most. And finally, the procurement databases. We have about 350 contracts, I understand, and those are in a database that you can go to and search through on the county website, which is different. A lot of counties don't allow that or don't provide that service. But these are contracts that include the boilerplate requirements, but they also include the statement of work, the things that we're expecting, the goals, and then they also typically include the provider's plan and how they're going to approach the challenge and meet their objectives. So these are things that right now the BHAB itself has a difficult time understanding what's going to be procured this year and what do we meet about, what do we talk about, because contracts, that we'll get a board letter with $70 million in contracts and not really understand, had we known 6 months ahead of time that those contracts are coming up, that might let different stakeholders that are interested in different things be able to read the statement of work and be able to go to the industry days, which are opportunities for the public and for any stakeholder to come and give thoughts on and feedback on procurement, future procurement actions. Without that knowledge of knowing what's being procured, we're largely flying in the dark there as well. So shifting over to the 3-year plan and update, this is a 600-page document. This is last year's. I took this slide from another presentation, but I have links to all the current 3-year plan for this coming year. So now I'm going to get into the budget areas, and although this looks a little complicated, I'll keep it simple. This is when, if you don't know, any millionaire in California that makes over $1 million in income a year pays 1% of that additional money into a fund, and that pays for about a quarter of California's mental health services budget. And I did this chart to illustrate what happens with the $1,000 that comes into the county. So every $1,000 that goes to the state takes out 5% for administrative work. And I have another breakout that breaks that out. But this, although it starts off at the very top of $950, I'm saying that for every $1,000 that comes into a county, that would be us. And that I think this year it's around $220 million. But for every $1,000, 80% of that goes into, or $800 goes into MHSA components, either CSS or PEI. And out of the CSS comes the prudent reserve and also the workforce and education. And I believe the capital facilities and technical needs also comes out of the CSS. When the CSS and PEI money comes in, you'll see that 15% is taken out, and that's distributed between BHS administration and the community program planning processes, and 5% must go to innovation projects. So, so for every $1,000 that comes in, 20% of it goes to PEI, 80% of it goes to CSS, and of those two buckets, 15% goes to BHS administration, which may include community program planning dollars or not. And the other 5% goes to innovation projects. The CSS and PEI funds need to be spent within 3 years. So every year the county receives a projection of what their income will be. And they, once they get those funds, every month they get a check from the state. And once they receive those funds, they have 3 years to spend them. For the capital facilities and the workforce education, they have 10 years to spend that money. And the innovation funds, they have 3 years. So when that money comes in, they can spend the money this current fiscal year or within 3 years. If they don't spend that money within those 3 years, the money has to go back to the state, and the state distributes it to counties in need. And one of the things I read in the plan this year is that our county has never reverted any funds out of the billions of dollars we've received to date. Since 2004, we haven't had to revert any. Okay, and by the way, the mental health fund budget this year for the state is $3.3 billion. And that money is distributed on a population basis. So, or a population index basis to each county, so at 3.3 billion. Okay, so one of the issues that I've been bringing to the BHAB for years is the unspent funds. And I learned about this through an article I read in, I think in 2016 in the San Diego Union Tribune that showed that we were sitting on a ton of money that, so that money that comes in and we have 3 years to spend, we take full advantage of that and we sit on it for those 3 years and we spend the money today that we raised oftentimes 3 years ago. So this is I believe page 47 of this year's plan, and I'll just walk you through it here. So the columns are the individual programs, the CSS, PEI, innovation, and the workforce. These are the amounts of money. So line one is the unspent funds that we had from the previous year. The second line is what we anticipate coming in this year, a new revenue, which is typically around 220 million. This year's 393 million. We anticipate in fiscal year 23-24 to get $390 million. That's a significant amount of money. And in transfers, remember I said that the workforce education and training can be funded from CSS dollars. So that's what's happening here. That 6.9 million is going into workforce education. So that's just a shift of some money. So the estimated available funding for fiscal year 23-24 is $474 million. Now you'll notice that I added a column at the very end, and that is because the prudent reserve is money that is calculated through a formula, and that's a static number. So that number is the amount of money that the county is required to keep in a fund that cannot be used other than for emergencies. And just so you know, we went through the pandemic and we didn't touch $1 of that prudent reserve. So the prudent reserve is when the house is on fire. And we haven't seen that yet. And I don't know if we've ever utilized any prudent reserve ever. I don't recall it in my experience in the last 6 years. So the bottom line is that the column G is the totals, including the prudent reserve. The next column over is one I added that is without the prudent reserve. So that's the actual amount of money. So the unspent funds from previous years is $81 million. So we started this fiscal year at the end of June. We will have $81 million above and beyond anything else that is excess funds. Now, you should also know this includes innovation funds, which is $35 million. So that's about $32 million that is in unspent funds. The innovation fund money must be spent on innovation. So when that money comes into the county, that $1,000, 5% of it has to go to innovation, and that money sits there until it's spent on innovation projects. So that 81 million includes 35 million that's committed to innovation. And then you'll notice then line 5 is the estimated available funding. So the 474 million is what we're starting off the year with, which is all the money without the prudent reserve. And you'll also notice I took out the column capital facilities because we don't have anything budgeted this fiscal year for capital facilities or technology needs, which is another issue, but this plan does not have that. So I carved out that column just because it was empty. So the estimated expenditures in this 3-year plan is $274 million. And you see it broken down by a different category. So at the end of the year, in column C, in the very last column, you see almost $200 million. That is 200 million minus the 53 innovation funds. So about $144 million is, or $146 million will be money that could be spent on CSS, could be spent on PEI and workforce education training, but is not going to be, it will be sitting there. And when we earn interest on that money, that interest is also included in the 3-year spending, so that when we spend that money within the next 3 years, we also have to include any interest we've earned, and that's diligently tracked. And each year at the end of January, the county reports its revenue and expenditure report to the DHCS. They review it, send back recommendations for modifications and edits, and then they're typically published. But we haven't seen the last RER on the DHCS website. But the bottom line is that every year these numbers are audited and the accounting is strong. So the question I bring up is why are we sitting on $146 million this year, which could be allocated in our programs? So I'm getting right into directly what can be done is writing your supervisor, notifying advocacy organizations, attending BHAB meetings and speaking up, and attending work group and committee meetings and attending council meetings. These are the meetings that are so part of this community program planning process, but we're often left unaware of how much money is sitting in the bank. And my biggest question, and it would be a question I'd be raising if I was sitting in a community forum, is why are we sitting on $146 million when we have the homelessness crisis and the opioid crisis and the just the increasing demand for services and the there's a number of things we could be spending this money on. And I think I'm not trying to be foolhardy or wasteful, but I think that the community would have a much different perspective of how this money is being used. And I can't imagine the majority of the community would agree that sitting on this money is a good idea. Now, there's often an argument that this money is used for extended program funding and all, and which is great. But when we keep forecasting that there's going to be less money next year, which I heard every year in BHAB, I always heard it's going to be less money next year. But it's been almost like a 45-degree incline on the number of years, the last several years. I think we were getting 180 million a few years ago. Now it's 393 million. So it's the amount of money we're getting from these this millionaire tax is significant. And last year, I think it was 600 million because a lot of COVID related revenues were coming in. So once again, this is something that I think the community should better understand and should not just take it as the spoken law, just because we're told that there's going to be a budget shortfall next year. I think we're all intelligent people. We know not to waste money, but I think we would have a different level of feedback if we had the opportunity. Okay, so I go into some budget questions like what's the budget for the CPP activities? And what this means is that when the community program planning processes are outlined, how much money is going towards staff? How much money is going towards training of people? How much money is going towards forums? Getting people engaged in through our website, and what programs and services are being used to serve the community. That we don't know, because this particular budget, as in every other year, does not include any money for CPP. So we don't have a budget for community program planning. What I haven't made really clear is that when that money comes into the county, 5% goes to innovation, the rest towards programs, but also 15% of that money goes to the county for administration, and up to 5% of the overall budget can be used for the CPP process. So I think this year it equates to about $12 million. So the county could be spending $12 million in engaging, training, equipping people to make more informed feedback throughout the year. And that's a real key point throughout the year, because typically we think that there's forums and then there's this MHSA plan, and the people get 30 days to review it. And that's the CPP. That is not the CPP. The CPP is the year-long community engagement. And when we don't have a plan, we don't know what is supposed to happen, and we don't know how much we're going to spend on it. It makes it very difficult for the Behavioral Health Advisory Board to give informed feedback to the BHS and their supervisors. The state requires, they give us a list of duties, and they're in the references here, and I can show you those later. But there's a list of duties that are required of the mental health board. And one of those is that they must review and approve the process or the procedures that the county will use for the community program planning. We have never, in the 9 years or 10 years that I've been involved, have never had an opportunity to review and approve the plan that the county uses to engage the community. Without that plan or that ability to opine, we're basically left as a board that just sits there and works on the things that are brought to us by behavioral health services. But the Behavioral Health Advisory Board's first job is to make sure that the community is engaged in a meaningful way throughout the year, and that they're trained and sufficiently capable of giving informed feedback. So without a plan and without the ability to do that, and without any funding or any idea of where the funding can go, the Behavioral Health Advisory Board is missing its biggest opportunity to, not only make informed feedback themselves, but make sure that the public and the stakeholders are given that opportunity as well. So when we're talking about all these things about that $146 million sitting there, and the public is, largely unknown, that's an opportunity to give feedback that it's a missed opportunity. So I provide, a bunch of links and to different resources that will help you understand all this stuff I'm talking about. And there's all the codes and regulations. And then just so you know, back in 2005, when the MHSA fund first started, our county spent $700,000 just developing a plan on how they were going to develop a CPP plan. So they built a team that had 17 people, 5.65 full-time staff, 1.4 planning experts. And then, so we spent equivalent in $22 of $1 million just developing a plan on how we would do a CPP. So this wasn't including the CPP, which I also include a link to in this slide, the final, CPP plan for that year. But we spent $1 million basically just building a team to do the CPP. And I think that that's, one of the things we should be looking at is this was a one-time thing that we did in the beginning. But since then, I haven't found any documentation that shows that we spent a concentrated amount of money on the community program planning process. And finally, these are, once again, the last slide is all the advisory board's duties. And so I'll start the presentation with this question: is when we know there's a tool that is meant to, inform people and bring meaningful contributions to the process, and it's funded with an extreme amount of money. I mean, $12 million to engage the community in San Diego is a significant amount of money. And I'm not saying we should spend all that, but I'm saying that there's a requirement for the Behavioral Health Advisory Board to review and approve the county's processes. We're not doing that. And we're going ahead each year spending this money under the assumption that the Behavioral Health Advisory Board has reviewed and approved the processes. And I would argue that this year's plan is really a report of what we did last year, and it shows where we're going to spend money the next year. But to me, a plan has objectives and challenges and opportunities, and then the strategies and tactics you're going to use to meet those objectives, with those opportunities in mind and with the challenges in mind, and what tactics you're going to use to do that. That to me is a plan. What we get every year is really a report of what we did last year and a statement of how much we're going to spend next year. But I don't see the critical analysis of why we're doing what we're doing, why we're spending money where we are. And I think that's where stakeholders would have a big interest in contributing. And I think it's something that is messy, and it can be time consuming and add another layer of bureaucracy on the whole process. But the MHSA fund was created because stakeholders wanted to have a stronger say in where their dollars are going to be spent. And when we circumvent that process or only do it partially, we're missing a lot of opportunities. So I'm going to stop recording there because I don't want anybody to feel that their questions or anything will be misconstrued. So I'll leave it at that. And this is the body of the presentation. We have some time for questions. Thank you. Oh, hang on a second. I quit the sharing, but not the recording.